Good morning, everybody. Welcome to another Mancoll Minute. I hope you had a great week. Just amazing walking in today, just the temperature and beautiful blue sky. So hopefully your day will be great. Um, it's interesting. The last couple of weeks, I've seen some folks that I'll say are a little bit on the older side, whatever that definition means to you, but they had a similar question for me. Am I too old for plastic surgery? Am I too old for X, Y, or Z? Whatever reason they came in. So I thought, let's just talk a minute about what's a good age, a proper age, too old an age. And I will tell you that there's not really one answer, okay? I mean, as a doctor, I have my comfort level with what I'm doing and how old someone is, but I don't really look at them chronologically in age. I mean, I have patients that go from, little babies on that side of what I do, all the way up to folks up into their 90s. And some of the things they come and see me for, remember I wear multiple hats. I've got my reconstructive hat, I've got my cosmetic hat, and depending on which hat I'm wearing when they come in will determine obviously what I do or how aggressive I get or how complicated the surgery is. But it still comes back to really just how healthy you are. I had a patient who was coming in for a facelift in their 90s who could run circles around me. This person worked a full job, a very active physical job, and was in incredible health on no medications, and was a great candidate for all the right reasons why you would want a facelift. And depending on how you do the anesthesia, it determines the stress on the body and the heart and so on. So there's lots of ways we can kind of tailor it. But then I also had another patient, right around that same time period, was in their 40s, and I really had no interest in operating on them at all because they had so many medical problems and they smoked that to me they were a very poor candidate because I perceived their complication risk to be much greater than that person that was almost 50 years older than. So the question of age is not really a straightforward, there's a line and once you get to it, you can't do it. So when I bring it back to, for any one person, what's the age issue, a lot of it is really the problem that you're coming to see me for. How much does it bother you? How important is it? And then my job as your doctor, just first and foremost, is it safe to do that? And like I said, keep in mind that some surgeries just have a lot more complexity, maybe blood loss, maybe deeper anesthesia, and others really, again, you wouldn't know if you didn't do this for a living. It's really pretty straightforward, simple, and breast aug's a great example. And that's a really simple, straightforward operation. You put some rib blocks in while you're numbing people up as they go to sleep. They don't feel a whole lot, and the anesthesia just kind of has them floating at a nice, comfortable level. We're in and out in an hour, 15 minutes, and that's not physiologically a very demanding operation on people, and they can feel better. I mean, it might have been something that bothered them a lot, so I'm doing augmentation sometimes, people in their 60s, and I've even done it in folks in their early 70s, because that's just simply what was important, and there's no judgment right or wrong. It was safe, they did great, and they were very happy. If you think about the facelifts and some of the more facial aesthetics, it's a sort of an easier way to do with just real light sedation. Patients don't remember because of the medicines, but you can block nerves in the face, so you've got your baseline anesthetic, and then the medicine's really just to help keep them comfortable, help them sit still while the surgery is being done. And again, the tolerances really are based on more your health than they are simply an age. So what I would encourage people to do is, if there's something that you really wish were different for whatever reason, and you've reached a stage in your life where you can afford to do it, you've got the time to recover, life's not so hectic because the kids aren't little anymore, they've gotten bigger and they're adults, the demands at work may be less, so you've got more recovery you can put into it depending on what it is, then come on and let's talk about what your goals are, what you'd really like done. And don't exclude yourself just because you feel like I may be too old for this. So that's part of my job, to do what's safe, to help guide you as what's appropriate for what you're looking for. And there is no cookbook. There is no graph to say, okay, based on your age and blah, 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 that you are or not a candidate. So it should be a good reason why we all want to stay healthy. So we can do all the things we want way into whatever age we're lucky enough to live. So if you have questions about it, or if you're not sure if, hey, am I too old for X, Y, or Z, give me a call. go on my website, the contact page. Remember, I answer all those myself. If they're clinical questions, if they're more admin, want to make an appointment, I'm going to get those to the right people in the office who can do that for you. And I look forward to seeing you. So have a great weekend, and I'll talk to you next week.